Hello, and welcome to Talk Trillium, Partnering for Patients. I'm Patty Cochran, Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which includes the Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre. I'll be your host today as we take a look at how our hospital is working to create a new kind of healthcare for a healthier community. And I'm so pleased to welcome Pamela Winchester and Belinda Patrickin, both registered nurses and clinical educators in our birthing suites at Trillium Health Partners. So could one of you tell us how many babies are born every year at Trillium Health Partners?
We do just over 8,000 deliveries a year.
That's amazing. 8,000 new babies joining our city, I guess, and that's the equivalent to a small city onto itself, actually. So can you tell us, what should an expectant mom know before she actually delivers her baby at Trillium Health Partners? Is there any information you think it's worthwhile that they know in advance of delivering a baby?
I think the first step when you're going to have a baby is who's going to deliver your baby, right? So I think it's important to know that at both sites, you can have an obstetrician, a family doctor who delivers, or a midwife who delivers. And it's up to personal choice, and they all practice a little bit differently. And you can go on to Trillium Health Partners website and click on if you're going to be delivering at Credit Valley site or Mississauga site, and it lists the providers there, and to be referred by your family doctor to one of those providers.
Great.
Yeah.
Anything to add, Belinda?
Just it's good to come in with your thoughts and your ideas, but to come in with your questions, because we know we have questions and we don't know what to expect, and everybody is different. So don't be afraid to ask your questions.
And what's the importance of prenatal classes?
They give good information, they're relevant, up to date, and it eases some of your anxieties of what to expect. It's your first time.
And so you advise people to take prenatal classes?
Yeah. And to use the information you get from your prenatal classes and to come with us prepared, a little bit more prepared.
And by being prepared, what should people bring to the hospital when they're in labor?
Only what you need, which is for some people they need more and some people they need less. But for moms, I think you really need those comfort measures for when you're in labor, whether it's a house coat, slippers. Some people like their own comfy PJs to wear. And then, your regular toiletries and underwear and pads and things. And then for baby, you need some changes of clothes and some diapers and some warm blankets. But that's pretty much it.
How long do they stay in hospital now after delivering a baby? How long does a mom stay?
For a vaginal delivery, they're there for about 24 hours. And for a C-section, you can expect up to 3 days.
Yeah. Right. Yeah. So what is a birth plan?
Birth plan, you can find them online. Usually it's a written out plan of what the parents would like, whether that be pain relief measures or how baby is taken care of, like skin to skin. And I think it's great to come in with a birth plan and talk to your nurse about it. I find that a lot of birth plans, we practice a lot of what people would like on their birth plan. So don't be afraid to have that conversation with your nurse, because you'll find out, oh, this is something we routinely do.
Mm-hmm. So who's in the labor room these days? It used to be that it was just the mom's business and it was really about nurses and doctors, but who actually participates in the whole birthing process?
We're a family-centered care focused program. We find usually we invite in support people during labor. It's not for everybody to come and watch and to hang out. It's for people to be there to support the mom while she's having a baby. And so I find usually the partner and a supporting family member or a good friend are usually there. But leave all the visitors and everybody at home. They can visit after the baby's born. But the people that are really there to support mom to go through this process to have the baby.
What an amazing job that you have. You see a new life being brought into the world almost every day. What's it like to have that as your career?
It's amazing. Just you see people when they're in pain, and then you see them afterwards. You get this different relationship you build with your patients, and it's so exciting and fun.
Yeah.
And people
Yeah.
remember their birthing experience. I know I remember it, and that
Yeah.
was a long time ago. So you really build memories for everybody. So thank you so much for joining us, both Pamela and Belinda, today, and sharing about what mothers should expect before they come to have their baby.
Thanks, Patty. It's been great.
Yeah, great. Thank you for joining us.
My name is Lori Soares. I'm one of the coordinating nurses at Trillium Health Partners, also the perinatal bereavement lead at the Seasite. I grew up in Oakville for my entire life. I always knew that I wanted to be a nurse and then decided to go back to school after my first child. I had such a great birth experience that I decided I wanted to be a labor and delivery nurse.
Hi there. Yeah, it's Lori. Do you want to just let me know what's going on in triage?
It was the last graduating class of the diploma RNs. So I had 2 pregnancies during that 2.5 session. So it was quite a lot of work. I think it made me more sympathetic in terms of taking care of our patients. The day-to-day work that I do here is taking care of our patients and trying to give them the best birth experience possible. That can mean many different things. A lot of our patients have no knowledge when it comes to what's going to happen to their bodies in labor. And so it's really important that when we're taking care of our patients that we're also doing health teaching. So roughly at Trillium Health Partners, we do over 9,000 deliveries a year. At Credit Valley site, we do just under 6,000. And at the Mississauga Hospital, we do just over 3,000 deliveries. So it's a pretty busy place. When you're a labor and delivery nurse, it's really like being an emerge nurse. You never know what's coming through the door, so you really have to be on your toes. Sometimes you think that all deliveries happen in labor and delivery, but that's not the case. There's days where we have adventures. One of the adventures that I can recall is the family that came in labor, bringing his wife in his brand new Lexus that he just picked up 2 days before, and we ended up delivering in that Lexus. Needless to say, the car needed some severe car detailing, and it didn't smell like the new car scent anymore. There was also a time, Easter Monday, where a patient just couldn't make it up to our department, and we delivered. I delivered in front of the information desk in the atrium. To bring new life into the world is phenomenal. To hear the first cry of each newborn is a feeling like no other. I'm gonna put him on the scale. Seeing the look on the parents' faces, especially if they're not knowing what they're having, and then telling them that it's a boy or a girl. I like to joke around with the patients when we're pushing, and oftentimes they'll say, "Oh, your baby's got blonde hair," and the dad's like, "Wait a minute, what do you mean blonde hair?" And I'm like, just joking, it's got brown hair. So try and keeping it light and because they're a nervous wreck too, so trying to keep a positive, light approach to the gift of life. I think the best advice I can give to a new mom who's pregnant and coming to deliver at Trillium Health Partners is to really keep an open mind on her pregnancy and labor and to what to expect. Oftentimes people come in with a birth plan and then they're disappointed when things don't follow exactly what happens in their birth plan. So I think the best thing is just to kind of keep an open mind of what you kind of want at delivery and take it minute by minute, sometimes hour by hour.
Thank you. You're welcome.
I feel as a nurse, this is one of the best places that you can work. You get an adrenaline rush every time you come to work. You'll stay busy, and as well, you can have a really rewarding work experience.
Mothers delivering at Trillium Health Partners receive a lot of support with breastfeeding. The nurses have been trained in the Baby Friendly Initiative, which is an initiative that helps to promote and support breastfeeding. So they've received that extra education and training. Right from the labor and delivery department, moms are encouraged to come over from labor and delivery with their babies skin to skin. And skin to skin is a way to have the baby on mom's chest so that the babies are in their natural environment, and it helps to keep them warm and it helps to encourage breastfeeding. The nurses over on the mother-baby unit will support the moms with breastfeeding, and they also have access to a lactation consultant that teaches a daily breastfeeding class and helps to kind of increase the support and confidence of moms while they're learning their breastfeeding experience. So if mothers decide not to breastfeed, they are equally supported here because the Baby Friendly Initiative supports mothers who breastfeed and mothers that don't. Those mothers are taught individually how to prepare a formula, how to administer or give it to the baby, they're helped with positioning. Very important for a new mom to kind of try her very best, and we know it's very challenging, to get enough rest, sleep, and nutrition. So that balancing of that, she might want, if she's coming into the hospital, dad often will come with mom or the support person partner. Other family members like grandparents will sometimes come and support mom in the room. We want to make sure that she gets rest in between feeding the baby. We want to make sure that she's eating and getting proper nutrition. Rest is very, very important because the breast milk is going to be a little more abundant if mom has a little bit more rest and is more relaxed. So that extra support in home and in the hospital is key.
Hey, Sandra. So how was your night?
It was okay.
Whether a mom has had a midwife delivery or a family practice doctor delivery or an obstetrical delivery, all the moms receive the same care and opportunities. They're all looked after by the nurse in the hospital. They have access to the breastfeeding class and the services within the hospital. There's a public health nurse that will come in to see the mom prior to discharge to talk about the Healthy Babies, Healthy Children program.
Thank you so much.
No problem. Thank you so much. No problem. Bye.
Bye.
Take care.
A new mom at home should realize that probably things are not going to be the way that it was when she left it. And she might think that when I come home, I'll just be able to get the baby to sleep and I'll go and do this. She needs to expect the unexpected, and I think that makes it easier to transition to that lifestyle at home. Newborn babies they haven't read the book. They didn't make the plan. They just kind of go with the flow. And if mom can kind of do the same thing like her baby and just go with the flow, that'll make it easier.
Every new mom has their own story and experience of pregnancy and motherhood. Today, we're very lucky to have Michelle Rydell and her son Toby, and Natasha Sharma and her son Dane. And both Michelle and Natasha delivered their babies here at Trillium Health Partners. In fact, this is the second time they each delivered with us. So welcome, and welcome to our special guests this morning. It's so wonderful to have them with us. Maybe I'll start with you, Natasha. Is there anything that you think our viewers should know if they're expecting their first baby before they actually deliver that you weren't aware of?
I wasn't aware that you may not be able to get the OB/GYN or the person that you're working with delivering your baby. So that was interesting for me. You know, you have someone follow you for 9 months and you develop a relationship, and then, you know, you're going to get to Trillium or the hospital that you're delivering at, and it's going to be the person who's on shift. And it's important, I think, for moms to, you know, I wish I'd known that in advance. And also to know that they change shifts after a while. So it's good to kind of have that expectation. But I found the staff at Trillium to be very, very good. So it's good for them to know that even though they might not know who they're delivering with, that the staff are very compassionate, usually very well trained.
Great. And your story, Michelle, everyone's got a different story.
Yes, both of my children came early. And
Wow,
yes.
that's unusual, isn't it?
Yes, it is. And as a first-time mom, I would say expect the unexpected. You know, I didn't have expectations, so I wasn't disappointed, and I think that was important. My daughter particularly, I had preeclampsia, and so it was a different experience. We had to get her out in a hurry, and she came out fast, and you know, the nurses there, again, to Natasha's point, were my saving grace. They were such a great support system, and they really led us through. And I think the other thing is I asked a lot of questions. So you've got to just communicate with the staff when you're there.
So you had an unexpected experience. You actually delivered early.
I did,
And
yes.
very quickly.
And very quickly, there were not time for, it was a natural birth, I will say that. And so as a first-time mom, that can be really intimidating. But the nurses, they were fantastic, and I just feel like I took advantage of Trillium's resources. So I used the birthing tub both times, and that made things really a lot more comfortable for me, and it made the labor go a lot faster as well too. So I think it's important to take advantage of the resources that the hospital has to offer.
And Natasha, did you deliver early and were you quick?
I delivered late. My first guy didn't want to come out at all. This is my second. But with my first, I was induced actually 14 days after the due date of my first son.
And I think that's more typical, isn't it?
It depends.
I'm not the norm.
Everyone's different. But like Michelle, I also managed my expectations very carefully in that I was flexible to anything happening, because birth is the one thing that you really cannot plan, anything. And so if you try to plan it, you're almost setting yourself up for disappointment, because it's going to go how it's going to go. And my first guy was delivered after a number of hours of trying in labor. And, you know, we chose medication, and that was a great decision for us. But then he was delivered by C-section, and it was fine. It was a very smooth and very, you know, they obviously knew exactly what they were doing at Trillium. You felt like you were in good hands. They were confident and they were assured, and that's who you want to be working with, you know, in a moment like that. So yeah.
It's really not a pass-fail event. It's not as if you're doing anything wrong or different. It's just the way things evolve. Hi there, Dane. Hi. And what about after delivery? I understand you're part of a support group.
Yeah. We met through a local moms group, and I think that was one piece of advice I could give to new moms is really like find your tribe. You know, find the people that are going through the same experiences as you, and even if you don't do things the same way, you have shared and common experiences, and you have someone who understands what you're going through in the day to day. These guys are amazing, but I also think it's unrealistic to think that they're not a lot of hard work too. You know, so it's good to have someone to commiserate with over maybe a coffee or a lot of coffee.
Yeah.
Yeah.
And some wine.
And some
Come on,
wine.
Let's be honest.
Yeah, exactly.
Yeah. Any other last words of advice, Natasha, from your experience?
Just be flexible, be open. I agree with that. It's really important for moms, but for all parents, dads too, to try and make some acquaintances or friends with people who also have kids, because there will be moments where you'll need to ask questions or just, you know, talk and share. And we connect through sharing, so it's really important. And, yeah.
And both your children are obviously so healthy and have been so well behaved during this segment of the program, and I'm sure this is their first.
I have a buddy, like this guy's trying to hug the camera. What is he doing?
Well, I want to thank you both for joining and bringing Toby and Dane with us. It was our first episode with children and infants on our show, so thank you so much.
Thanks for having us.
Thank you.
Yeah, no, it's great.
Yeah, it was great. And remember, if you have any questions that you would like answered, please send us an email at talk.trillium@thp.ca.
I do recommend taking prenatal classes. This is a big, big day in your life, and you need to be prepared for it. And there are things that can change in a moment. And the better informed you are and your partner are, the easier those transitions are for you. So I highly recommend there's different, you can take private classes, online classes, Region Appeal offers classes. So I highly recommend educating yourself before you come in. Everyone looks for that movie moment where you have a big gush of water and your water broke and you go in the hospital and have your baby. So it often doesn't happen that way. Sometimes you have a big gush of water and it's very obvious, and other times you can have a high leak, or it can be other things happening. So if you think your water's broken, which usually we say if you keep having leaking that doesn't stop, come into hospital and we'll check. If it's not time, then we'll tell you it's not time, and we'll provide the teaching that is most appropriate for what is happening. But at any time, 24/7, you can come to our labor assessment unit and we'd be happy to assess you and baby. So the best advice we can give is bring the people that you want there to support you through this process, especially if it's your first baby and you don't know what to expect or how you're going to react. You need people there that are going to support you no matter what. And we understand that families are very, very excited and often all come in here and wait for the baby, and then they find out they're waiting 14, 16 hours, and that can be very exhausting for everyone. So we recommend you bring the people you want to be here for the whole process to help you and support you, and that you're comfortable having there for that process. For all the other people that are really excited to see the baby, we recommend calling them after and they can come visit you in your room. So the first few minutes are often quite euphoric. So often, and a lot of women have epidurals, so they don't experience a lot of pain immediately. If you have had an epidural, that wears off. There can be quite a bit of discomfort in the following days as you're getting up and moving around, and also looking after your new baby. So we tell women to do a lot of preparation, a lot of reading about what to expect after their baby's born. We'll do a lot of teaching in hospital, but your body will take up to 6 weeks to get back to its pre-delivery state. So give yourself time and don't be hard on yourself. So we say it's a great idea to prepare to be able to stay in your house for about a week with just you and baby and the family working on bonding. So to have your house ready with lots of diapers and wipes and supplies for you, as well as your baby and other children if you have any. As well as the nurses are going to send you home with some great educational materials and community resources for different things, as well as information on how to register your new baby. So it's very important that your baby has a safe car ride home. So it's important that you get a car seat that has not passed its expiration date, and that differs with different manufacturers, so it's important to look up. Your baby will need to be in a rear-facing car seat, and we do recommend that you install that car seat and get to know the features very well before you come to hospital to avoid a very stressful parking lot experience going home. So at the first visit, your baby will have to see your family doctor within 2 to 3 days of discharge. Your baby will get weighed, have a head-to-toe examination, and the doctor, whether a family doctor or pediatrician, will talk to you about how that baby's feeding, growing, and sleeping, and looking at the milestones the baby should be reaching at that time. Mom should be seeing her own family doctor within 6 weeks of the delivery to make sure that she's well healed. So postpartum depression is a very serious issue. If you feel that you are experiencing symptoms of postpartum depression, I recommend you or your partner or other support people go online to look at community resources, as well as you need to make an appointment with your family doctor and discuss your issues. I highly recommend you take someone with you, as sometimes other people around you notice symptoms that you may not be recognizing yourself. But the ultimate advice I can give is to get help early. You are at a much higher risk of experiencing postpartum depression again if you have in the past. So we recommend that you bring up these issues with your care providers. We have clinics that we can refer you to ahead of time before the baby's born to make that contact, so that there is a plan in place once your baby is born, so that you and your baby can bond well and do well in the postpartum course.
name is Steve Langdon. I'm 46 years old. I'm husband of Annie and father of Vanessa and William. On September 11th of 2015, I was out mountain biking with some friends. Within minutes of me riding the mountain bike into Bronte Creek Conservation Area, I started feeling a little burning sensation in my chest. One of my friends actually said, "Do you think you're having a heart attack?" And I said, "There's no way I'm having a heart attack. It's impossible." So I rode back to the van, and by the time I got back to the van, I couldn't even lift my bike.
A friend came rushing through the door and he came to get me, and he said, "Steve's sitting on the front porch and he's not feeling well."
My friend dropped me off at the Credit Valley Hospital. I could see signs. I couldn't even figure out where to go. And I sat down, and it felt like it took 30 minutes to get the words out, "I think I'm having a heart attack." I was transferred to the Mississauga Hospital. I ended up getting 4 stents through emergency angioplasty. One artery was blocked to 100%, and one artery was blocked at 95%.
And this is really when it sinked in that this was happening and Steve was having a heart attack and it was a real deal. And then I suddenly got scared that maybe he wouldn't come back, like, because people die from heart attacks.
But I didn't have any telltale signs, and I certainly didn't believe I was having a heart attack right up until I showed up at the hospital.
The one thing I kept thinking about is I really didn't want my kids to lose their dad.
I was okay.
Yeah.
The speed of intake was remarkable. The speed of diagnosis was very comforting. The caregivers, everything was as good as you might expect in a world-class health facility. I want to say thank you to everybody at the hospital, and know that your work really matters, certainly to our family and to a large number of folks in the Halton, Mississauga area. So thank you.
I should really say thank you for saving my husband, but I want to say thank you for saving our family.
If you have any questions or comments about what you saw in today's program, please email us at talk.trillium@thp.ca. Thanks for watching, and see you next time.